Hi, Chris. Thank you so much for joining us today. We're here to film another episode of Cracking the Code, and we are talking about data mapping and keeping the patient safe. How are you today?
Doing great, Natalie. Thanks. Good to be here.
Well, I know you have some slides prepared for us. We have some questions for you. And first, I'm wondering if you could tell us a little bit about data mapping and how it's relevant to the regulatory and compliance space.
Well, that's a great question, Natalie. One of the things that if you ask a privacy official, a chief privacy officer, or someone who's in charge of making sure that either the privacy rule under HIPAA is followed or even just a data protection perspective, it's important for you to know where your data is at so that you can protect it. There's a lot of things that you can do with data. Regulatory compliance covers a lot of topics from a privacy by design perspective. You think about minimum necessary. It's usually tied to some kind of a role-based access control. If you properly map your data as well, you can facilitate consent management. Consent's a big deal. And if I'm giving consent for you to use my data, it's important, and the regs embody this, it's important to have transparent consent. And it's difficult to do that if you don't understand what kind of data you have, where this data is at, and how it's being used through the life cycle.
Okay, so well, given the importance of it, and given that maybe some consumers don't know what consent means when they're giving consent for their data, why is data mapping so hard? Why has it taken so long to adopt this practice?
I refer to this website a lot. It's a really great website. It's one of those Harvard projects. And what it does, if you go to this link, you'll find out that you as the patient right here, if you have one interaction with a doctor or a health insurance, life insurance company, your data goes all over the place. We call this data sprawl, and data is exponentially growing. There's more data now than there's ever been in the history of mankind. And parts of your data is spread out throughout all of these different places just from one interaction with a covered entity, for example. So it's difficult. It's also difficult to tie all this data together and make it interact and interoperate in a way that's going to help you save your life if you're in a situation where you have to receive urgent care or something like that. It's difficult. So the privacy officers of the world, they have a difficult task.
Absolutely. Just the sheer quantity. And then also, like you said, once you've consolidated it, what does the analyzing of that look like? And then how do you share that across organizations with so many different, digital health record systems out there? Okay, you mentioned data minimization and some of that on the previous slide. Yeah, if you could dive a little bit deeper into that, that'd be great.
Yeah, one of the premises of privacy is let's not take more data than we need to take. Let's not grab all the data that's out there. Let's use what we need to use. That's good stewardship of data management, good stewardship of data lifecycle management. Again, the regulations come back to minimum necessary access. It also equates to minimum necessary data pools. One of the things that you'll see in the past, some of these EHRs would, use an API to push a bunch of data. They would in the olden days, they would push 100 records at a time, even though the doctor may only want one record. It was just some of those ways of the systems behaving. So we've gotten better over time. Now we can eliminate excess data collection by using properly and fine-tuned APIs, for example. But really, if you think about data and the way ClearDATA approaches data management and works with our customers, we respect the human behind the data. To us, a data record represents a human life. And so that's why we protect it so much. That's why we encourage our customers to use our environments that are HITRUST certified, and constant security operations, constant privacy reviews. If you think about some of the GDPR requirements, we're still required to document what we're doing and how we're protecting that data, and minimization is a very key part of good stewardship of data.
Okay, thank you. And so that fourth bullet down, eliminating unnecessary and excessive data. Do you have any insights on how current companies are currently doing this if they're not partnering with vendors for good stewardship?
Yeah, there's a way to de-identify data if you're going to be using a whole bunch of data for studies, for example. They have things like data studies. These are clinical trials using data. And a lot of times what happens is a covered entity or a clearinghouse or an insurance company will want to understand some insights from a whole bunch of data, but there's ways to take that data and make it more private without exposing it to 100 engineers at a big cloud provider. You can take steps to make it only available to certain folks, and even those folks can see the data, and it doesn't have to show the identifiers per se.
Okay, thank you. I know that the U.S. has some slightly different regulations than international rules. Can you talk a little bit about the difference between the two and maybe how ClearDATA can help with managing both of those different systems? Those privacy rules, HIPAA and GDPR, for example.
Yeah, I mean, this is a topic that I really have been pounding the table on for a number of years. It's time for the U.S. to have a federal data privacy law, because what's happening is we're essentially California is dictating what should happen. It's not a bad thing. In fact, I think California's data protection laws are pretty good. They mirror a lot of what GDPR has. But I do think that there have been efforts to create a privacy law, but it's very difficult to enforce. It's very difficult to adhere to a law that is different in 50 different states. It's just very difficult. So I'm hopeful that at some point we can get past that.
Absolutely. So within this, there's the difference between, just for the audience, there's personal health information, there's protected health information, there's any personally identifiable data. Can you talk a little bit about kind of what data mapping is looking at in the context of, is it healthcare data? Is it all data? If you could break that down for us.
That's a great question, Natalie. There's a lot of misconception around, hey, I've got this app on my phone. It's tracking certain health characteristics. I did my Orange Theory run this morning, and I'm sure all of that data is now in the Orange Theory app. And I'm thinking, okay, great. I'm sure that because it's medical in nature, health in nature, it's protected. Well, it's not. The misconception is that the only data that is protected under HIPAA is data that has traversed either treatment, healthcare treatment, payment of healthcare, or healthcare operations. We call that TPO. And if data comes across one of those three things, then you've got to think about the 18 identifiers that encompass the HIPAA privacy and in part the security rule. There's a lot of different types of data. In fact, we talked about HIPAA having 18 identified identifiers, if you will. GDPR, we've done some analysis, and we think there's around 130 different identifiers if you think about categories of special or of sensitive information. There are tools out there that help us understand what kind of identifiers that we could hone in on and take a look at and make sure that we protect. Amazon Macy is a great tool. We've identified around 156 identifiers that Macy can readily grab, and Purview is another one. They're coming in around 109. So if you think about all of these different identifiers and you think about the context of what my name could represent in context of maybe where I've traveled, or maybe where I live, or maybe what clinic I've gone to, you can glean a lot of information from these identifiers. That's why they're in many cases very sensitive and very protected.
Thank you. That's helpful. And you spoke a little bit at the very beginning about consent management, and when we as consumers provide consent, and what does that even mean? And we talked about this on a previous Cracking the Code as well. But can you go into how data mapping actually works with specific types of consent that consumers are given and patients are giving?
Yeah, you can actually create a specific consent requirement based on the data that you have. And in order to do that, you have to actually map the data. You have to understand where the data is supposed to be. Probably more importantly, if you see data that's somewhere else where it shouldn't be, that's something that you need to think about, because what you're doing is you're making promises to consumers or to patients, and you're saying, hey, I'm going to protect your data. I am going to make sure that nobody else accesses your data. I'm going to make sure that it aligns with what you've agreed to give me. Again, it's all about protecting and respecting privacy rights, allowing humans, those of us who care about our data, allows us to make decisions about our data, who can access it, who shouldn't access it, what you can use it for. If you don't understand where your data's at, if you don't understand the elements within your data set, it's very difficult for you to adhere or honor the consent that you've been given by your customers or your patients.
Right. And that plays right into who's accessing it and who has the ability and the minimum necessary rule. And yeah, if you could dive into that.
Yeah, I mean, this one is fairly self-explanatory. We support granular access controls if we know what kind of data that we have. We have to think about on the engineering side, on the cloud management side, the security side, who's authorized to get into a database and either make sure that it's being encrypted properly, or even just, old school indexing. How do you maintain and manage that data? We'll talk a little bit about data lifecycle management as it relates to access. One of the things that we talk about is protecting that data at every stage of the lifecycle. I'll show you what that looks like. This is the life cycle of data. You create data, you use data, you distribute it in some cases. You certainly have to maintain it. And of course, disposition means either you are archiving that data or you are destroying that data. It has a life cycle. And one of the things that we try to do with our customers is map the controls necessary to protect that data at each stage of that life cycle. And so again, understanding the data lifecycle, understanding the mapping of the data and how the data flows through your system and where it's going is very important in order to adhere to that lifecycle. If you've never done a privacy impact assessment, this again helps us figure out what the risks are to a data set. We have a customer that manages hundreds of millions and millions of records, and they are constantly doing data protection impact assessments. They're doing privacy impact assessments, making sure that the de-identified data that they have is not readily re-identifiable. These are important. They're just like, if you think about a security risk assessment, a privacy impact assessment helps you identify that risk to your privacy and what safeguards you need to put in place for that.
Thank you. And just want to make sure we zoom out again and looking at the patient and what is the impact on the patient here. Yep, thank you. We talked a little bit about the interoperability between the different systems. This doesn't mean much, right? If the different systems can't speak to one another.
Yeah, I mean, if you think about how we save lives, it's having a whole picture of the patient, not just what we're seeing in the X-ray. You have to understand what the history of the patient is. You've heard of these stories of someone being saved from a heart attack because a doctor looked at the Apple Watch, for example, and saw some history, or looked at the iPhone and saw history of the echocardiogram. Whether it's fit for military grade or not, it's still great information. So if you think about all of the disparate data sets, you can really get a good picture of what's going to happen to a patient if you have the whole history, the whole continuum of their life cycle. That's another area where I think AI is going to be a really fun and important part of healthcare.
Absolutely. Well, we've talked in the past about, maybe the benefits of AI in healthcare, maybe some of the shortcomings, but where do we go from here?
Yeah, I think population health management is going to benefit from AI in a big way. If you think about massive demographics, it's no longer just a data lake where you can throw everything in the kitchen sink into this big, huge data lake and try to pull some outcomes out of it. I think AI is going to really help us understand the disease characteristics that we see from other risk factors. Maybe I live in this part of the country that has, poor food choices. I won't name a restaurant, but let's just say there's a lot of French fries, and maybe that it contributes to certain diabetic outcomes. So again, I think AI is going to be really helpful in a lot of ways for this.
Absolutely. Okay, so the future of data mapping, what does that look like in the general industry context, and who do you think is adopting this first?
I mean, I go back to Mad Men, if you remember watching that show, and at kind of the end of the series, you get the Coke commercial. If only the whole world could sing together, right? This is, if only we could get this vision on the roadmap, or actually in reality, rather. I would love to see cloud environments that can produce these data maps with reporting, with alerting, whenever that data has left the nest, if you will, in a way that shouldn't have. I would love to see cloud systems that can identify sensitive data elements. We talked about those identifiers. It would be great if we could just label those things automatically so that we could continue to protect them. Again, we talked about context. My name in the context of what? I don't know. It would be great if we could leverage the full context of the data lifecycle from a record, from an identifier. I would also love to see AI play a role in finding suspicious data elements in a designated record set. A designated record set, by the way, is the golden record set of health data in a health system. It's not a copy per se, it's the actual golden data, if you will. And then, of course, I want to see tools that can identify where sensitive data is at any time, and have all that alerting, have all that reporting, etc. So that's my wish list, if you will, from a data mapping perspective. And some people might say I need to get out more often, but this is a very exciting thing for me.
No, it seems like there's a lot of opportunity for this area, and like this will not be the last conversation we have around data mapping in this context. So, Chris, thank you so much for joining us today and for sharing your insights. And we'll see you on the next episode of Cracking the Code.
Thanks a lot, Natalie.